Hello, Michael Gallagher, um, physical therapist. We're here again to talk about shoulder pain. In earlier videos, we talked a little bit about the anatomy of the shoulder joint and what can cause shoulder pain. We're going to talk about basics today. What can we do, one, to decrease pain at the shoulder, but more importantly, to prevent further injuries. Many times when we have shoulder pain, whether it be coming from tendonitis at the rotator cuff, bursitis at one of the 7 small bursal sacs that sit in the shoulder joint. We want to make sure not only do we eliminate the pain, we want to maintain our range of motion. We don't want to develop an adhesive capsulitis or a frozen shoulder. So today we're going to talk about some simple exercises we can do for any of these conditions at the shoulder joint, which will not risk or cause further injury, but more importantly, prevent unwanted sequelae which can occur with shoulder pain. As I stated in all my videos, that none of these things are ever to replace what you're being told by your physical therapist or orthopedic surgeon, but just some help to bridge the gap when you cannot see your physical therapist, medical doctor, or orthopedist in this time of quarantine. So the first thing we like to do with somebody who's having shoulder pain is get rid of the inflammation. We talk about rest, ice, compression, elevation. We want to ice the shoulder. A couple ways to do that: placing an ice pack on the shoulder. There are many ice packs out on the market today which actually give us some compression also. We're going to slip in here, Shannon. This is a cryo cup from Aircast, a nice little device which we fill with fluid. As it fills, it's icing the entire shoulder joint, but also giving some compression at the shoulder joint. Not many of us have these compressive devices at home. Your local pharmacies do have ice packs which better form or fit the shoulder. You can also order these online. A nice way of icing the shoulder. Difficult joint to ice in that you place an ice pack on there, you fall asleep, it winds up on the floor. Something that is going to wrap or hold on the shoulder makes it a little bit easier. So we're going to ice the joint. Again, people ask me, heat versus ice. Acutely, I always like to use ice. As the pain and inflammation decreases, many times I'll switch over to moist heat or a hot shower to help us regain or maintain the range of motion of the joint. The first exercise I like to do with somebody having shoulder pain is called the Codman's or pendulum exercise. So I'm going to have Shannon stand up next to the plinth, hold on to the chair, turn and face the camera, and what you're going to do is we want to take some of the pressure off the joint. We talked about that joint being a ball and socket joint. What we want to do is open up the joint. And the way we do that is what they call a Codman's or pendulum exercise. So I'll have Shannon bend slightly forward, let her arm hang in front of her, and she's just going to make gentle little circles, like she's stirring a cup of coffee or a cup of tea. It's not a cauldron, it's not a big pot of spaghetti, it's small little circles, letting gravity do the work. So basically rocking her body, letting the arm kind of swing like a pendulum on a clock, thus pendulum exercises. If this is easy, some people even take a small weight, something that weighs about a pound, can of soup, can of beans, something you have at home. What that's doing is, again, stretching the joint, relieving some of the pressure, whether it be on the muscle, tendon, or bursa sacs, opening up that space in the shoulder joint, helping to decrease pain. Seems simple. Most patients find it very, very effective. It can be done, again, 2 to 3 times a day. What I usually recommend is 25 circles in each direction and then repeat. Some people like to do this exercise just when their arm is feeling sore as a stretch. It's a little uncomfortable. Let me hang, let me stretch out that joint. Very, very effective way of decreasing pain. The next exercise I'd like to show is a way of maintaining our range of motion in a comfortable way, preventing further problems of stiffness or that shoulder freezing up on us. So what I'm going to have Shannon do is lie on her back with your head down this end. So slide around the other way. This could be done off the edge of your bed or the edge of the couch, laying flat on your back. We're going to let the non-involved, or the arm that's not hurting, help the arm that is hurting. At home, a wooden dowel, an umbrella, a golf club, a yardstick, all works well for this exercise. You're going to hold it with both hands. You're going to slowly raise your arm above your head, letting the non-involved, or the good arm, do most of the work, and the bad arm coming along for the ride. And slowly coming over your head, letting gravity work down to stretch and maintain mobility at the shoulder joint. As I said, this is more of a stretch, so we're going to hold this for 15 seconds comfortably. If it hurts, you don't have to go as far. If you're feeling a little bit of a stretch, you can try to go a little bit further. Again, remember gravity doing the work. You're not forcing this motion. It's a stretching exercise, not a strengthening exercise, and that's why we're holding for 15 seconds, and again doing 5 repetitions. And relax, and we'll have Shannon repeat, and up and over. So each time we do this, we try to go a little further, maintaining the flexibility and mobility of the shoulder joint to prevent those sequelae which can occur with chronic shoulder pain. In our next video, we'll talk a little bit more about strengthening the shoulder joint. Have a good day.